I felt a jolt of energy go up my body, and then I passed out and woke up in the ambulance.
Stories like this are more common than you might think. Epilepsy affects some 2 million people in the United States. It is a serious medical condition. But by working with their doctors, people with epilepsy can carry on with their lives. To help you learn about managing epilepsy, real patients are sharing their stories.
I definitely don't think epilepsy has held me back at all.
You'll also hear from leading medical experts. And actor John OHurley, an advocate for epilepsy awareness and action.
And I think it's extremely important to know that you are not alone. You are just one of the many, many people who happens to have epilepsy.
There are many reasons you might recognize John OHurley. For years, he has hosted the National Dog Show on Thanksgiving Day. You might have seen him Dance with the Stars, or enjoyed his recurring role on Seinfeld as Elaine's boss. He's also a gifted composer, an author, and a motivational speaker.
I speak on the notion of the extraordinary life, how to live your life extraordinarily.
One part of his own extraordinary life is raising awareness about epilepsy. For John, this cause is intensely personal.
I was exposed to epilepsy through my sister at a young age.
John lost his sister in 1970 when they were both teenagers. A lot has changed since then. To honor her memory, he urges people to find out about all the treatment options available today.
Become your own advocate. Learn as much as you possibly can about it.
The brain is amazing and complex, the control center of our bodies. When the brain's normal activity is disrupted, however, we can experience a seizure. It's like an electrical storm in the brain.
And of course, a seizure is essentially a symptom. It's a symptom of the brain, what some people call short-circuiting.
While an injury, high fever, or disease can trigger an individual's seizure, epilepsy is an ongoing condition.
It consists of recurrent and unprovoked seizure episodes. And epilepsy can begin at any age, from the very young to the very old.
Wait, 3, take X.
We are actually moving away from any national news or
Tamra is an active young woman with a bright future. At Emerson College in Boston, she's already working as a broadcast journalist.
I get to work with the equipment, behind the scenes, in front of the scenes, and I really get to learn a lot about journalism on all standpoints.
She also competes in beauty pageants, not only to win titles and scholarships, but to deliver a message as well.
I actually began pageantry because of epilepsy. I thought that it was a way that I could kind of encourage other people to study up on epilepsy and really get to know the condition.
Tamra's epilepsy education began when she was 14. In the middle of the night, she suffered an overwhelming seizure and lost consciousness.
And my best friend, fortunately, was sleeping over that night, heard me fall in the bathroom, and once she found me, she of course got my parents and woke them up.
Her parents called 911. They didn't know what was wrong, but they knew Tamra had experienced something that required immediate medical attention.
So some seizures start all at once in the entire brain, and we call those generalized seizures.
In the past, the term used for a generalized seizure was grand mal. Doctors who specialize in treating epilepsy may refer to it as a tonic-clonic seizure.
And this is the most obvious seizure, the most catastrophic. Oftentimes sudden onset, with or without warning. There may be stiffening, repetitive jerking of the arms and legs, loss of consciousness. There may be abnormal respirations. The patient may bite the side of their tongue. There may be urinary incontinence. The patient may injure themselves. They may fall on the ground, dislocate their shoulder, strike their head. After the seizure, there's a period of confusion and headache and gradual recovery.
The other sorts of seizures occur as they start as a tiny part of the brain, and they may be so small just to produce a single symptom like twitching of an arm or a language disturbance.
Tamra now believes she had those smaller seizures for years before the one that sent her to the hospital. They're called focal or partial seizures, and they can be much less obvious. Unless a focal seizure spreads, the only effect might be a brief moment of staring, confusion, language problems, or physical effects. Even leg pain could be a symptom.
I used to complain a lot about one of my legs and having pain in it and numbness in it. I just assumed that I had issues with my nerves from playing sports and never would have thought of epilepsy, didn't even know what epilepsy was.
Epilepsy is the name for a group of medical conditions that cause seizures. There are more than 25 different kinds of epilepsy, each kind caused by a different type of brain disorder. A tendency toward epilepsy can run in families.
There are multiple seizure disorders and multiple seizure types.
About half of all seizures have no known cause, but scientists continue to learn more about how and why they happen.
And we're seeing lots of great research that I think will result in much better understanding and control of seizures.
Today, Fred is relaxed, enjoying his retirement from a long career as a computer specialist. But just 2 years ago, his life was in turmoil. He had a seizure while changing planes at a Michigan airport.
And the next thing I knew, I was in the local hospital in suburban Detroit. My initial thought was that this has got to be some kind of heart thing.
He returned home to Boston, where a series of tests was done on his heart, but nothing seemed amiss. Until a few months later, when he was biking home from work.
And while cycling along, I kind of knew something wasn't quite right because I sort of felt like I was going to black out. So I had the sense to get off my bicycle and get up on the curb.
Once again, Fred woke up in the hospital. This time, he was referred to a neurologist.
A neurologist is a doctor that thinks about the structure and function of the brain itself and works together with the rest of the medical professionals to really focus and specialize on brain and nerves, and to some extent the relationship between nerves and muscles. Can you put your arms out for me, just flat, like you're holding a tray? Close your eyes and hold them right there. Don't let them move.
Seizures rarely happen in the presence of a healthcare professional.
Relax, and I want you to put your arms up like that for me.
So the process of figuring out if a seizure is due to epilepsy begins with a conversation and a physical exam.
Close your eyes and tell me which side I'm rubbing my fingers on. And push in. Good, and now the other side. I want you to tell me, is this vibrating?
Okay. The initial diagnosis of epilepsy really is based on the medical history.
Now we're going to put on the first electrode, which is the occipital.
A test called an EEG may add important information as well.
An EEG is a way of looking at the brain waves, the electrical activity in the brain. And like an EKG is used to look at the electrical activity of the heart, an EEG is used to look at the electrical activity of the brain.
But not everyone with epilepsy has an abnormal EEG.
So if we look through here, these are the frontal lobes, these are the temporal lobes. And as we
Another test that may be helpful is an MRI. This test might reveal problems inside the brain that could be causing seizures. Blood tests may be used to look for any possible medical causes, such as infections. An underlying cause might not be found. Even so, having the diagnosis of epilepsy means you can move ahead toward treatment. Although no two patients are identical, and doctors cannot predict exactly how a patient will respond, the goal is always the same.
The goals of treatment are no seizures, no side effects, no lifestyle limitations.